Hey there, I'm Kelly Cudd. I'm a postmaster's FNP student, and this is Madison, my daughter. She has agreed to complete the neuro assessment with me, or to allow me to do the neuro assessment on her. So one of the things I would look at when the patient comes in the room, or when I come in the room, is I would look at the general disposition of the patient in the cranial nerves, and kind of look to see if I see any noticeable abnormalities with like drooping or anything, or weakness in an arm or a leg, just to kind of clue me in ahead of time. So the first cranial nerve that I'm going to assess with Madison is going to be the olfactory cranial nerve, and it's the scent. Miss Madison has watched way too much or listened to way too many pod things. So as you can see, please don't look at the TV screen. You can see what this scent is, and you can see what this scent is. And so I will have her smell these. So Madison, when you do the smell test, can you please occlude one of the nostrils and tell me what you smell? First, check your nostrils and make sure they're not blocked with allergies. Are they good? Okay. All right. So, here you go. I got it. Can you say that louder?
It's vanilla.
Could you smell it? Yes, it is vanilla. Could you smell it in both nostrils? Mm-hmm. Okay. And as you see, I had those, like I have it covered in this hand. All right.
Each nostril smells.
Yes. All right.
That's the lemon. I knew.
So, in case you didn't hear, Madison said that was lemon. She knows her smells. So now that we've done the olfactory, we would go to the vision. I do not have a Snellen chart, but I would need to assess her vision acuity, which is cranial nerve number 2. The first cranial nerve, or cranial nerve number 1, was the olfactory. So cranial nerve number 2 is the optic cranial nerve, and I would need to assess her visual acuity.
It's not that good, I can tell you.
She recently had an eye exam, but I would have her go to a Snellen chart, and you want the patient to stand back about 20 feet from the Snellen chart. And to do the test, they would cover each eye and read the lines as far as they could read it, until the readings were not accurate, and then they would change eyes to cover the thing. So the second part of cranial nerve 2 assessment is checking the pupils. So what I'm going to do, Madison, is I'm going to check your pupils, and I'm going to make sure they're equal and reactive. Well, just look straight ahead.
What's at the bottom of it?
Nope, just look straight ahead. And her pupils were equal and reactive once her eyes got still. So the third cranial nerve, the fourth cranial nerve, and the sixth cranial nerve we will assess together. And what we're assessing for those is the extraocular movements, and also for convergence. So what I will do, Madison, is I'm going to have you follow my pen light, okay? So you'll follow it with both eyes. I won't have it on, but you will follow it with both eyes. Is that okay? Okay. Don't move your head. Just follow it with your eyes. All right, so up. And I'll follow the pen light. Thank you. I'll always come back to the center. Madison's trying to beat me to where I'm going with the light. And she did not have any abnormalities. Her eyes were equal, and they both tracked good. All right, so I want you to watch the pen light come in. That bothered you?
It
Okay.
makes my eyes go like that.
Yeah, that's kind of the point of it. Oh, so that was normal, the convergence test. All right, so Madison, there's another test we're going to do. It's called a wiggle test. A wiggle, wiggle, wiggle test. All right.
To do that?
No, you don't have to wiggle. All right, so take your right hand and cover your eye. There you go. And I'm going to cover my eye. And I want you to let me know whenever you can look straight ahead. Let me know whenever you can see my fingers.
I can see them.
You can see them?
I
Okay.
can still see them. I can still see them.
Okay.
This one?
All right. Yep. Cover your eyes.
I can still see your hand. I can still see it. I can still see it. I can still see it.
No, I did not make a
Oh.
for you. All right.
I'm listening.
Mm-hmm.
I can still see it. I can still see it. I can still see it.
Okay. She has good peripheral vision. She may not can see the chalkboard at school.
Oh,
but
I can't see that.
yeah. Okay. So that was the peripheral nerve 3, 4, and 6. So the fifth not peripheral nerve, but the cranial nerve is the trigeminal nerve. So what I'll have to do, we're wanting to assess the trigeminal nerve. So, Madison, sorry, it's okay. I'm going to touch you with some cotton, and I'm going to let you tell me when you can feel that, okay?
Okay.
Okay. Do what?
On my face.
On your face. All right. Can you close your eyes? Can you tell me where you feel it in a minute? Okay.
Oh, tell me when you're going to put it on.
Well, I'm not going to put it on your eyes just yet. So close your eyes, and you tell me where you feel it, okay?
Right here.
All right. There? Okay. Here? Mm-hmm. Mm-hmm. Yeah?
I'm sorry.
It's okay. That hurt? Okay. Now. All right, close your eyes.
Just help me with that.
I'll be careful. Tell me where you feel it. Mm-hmm. Right there. Okay.
That makes me sleepy.
Makes you sleepy?
This is why I watched.
Oh, that makes you sleepy.
Yes, that's all.
All right.
That's why I know about cranial and everything. It's a million videos I can do.
Million videos?
Mm-hmm.
Okay. So next, I'm going to assess her corneal reflex, and I'm going to take the whisper of cotton and kind of go across her cornea. It's not going to hurt. Can you open your eye for me? Open your eye for me.
I can feel that, alright. Yeah.
All right, open your eye.
I can feel it. I can feel it.
Okay, so I don't think Miss Madison is going to let me do that, but what I would do is I'm looking for the corneal reflex. And you would take the cotton ball and you do a wisp across the cornea. Yeah, Madison.
Let them dilate me at the eye doctor.
Yeah, well,
let me do that.
True story. So what I'm looking for is to see that there is a blink present. If there is not a blink present, that means that there could be a lesion. If both eyes do not have a blink on cranial nerve, there could be a lesion on cranial nerve number 5. If the patient has weakness and there is an absent of a blink on the side of the weakness. There could be a lesion on cranial nerve number 7. So okay, we'll put this up. We won't touch your eyes with that.
That was
No, yes, it was.
no be agree.
Yes, it was. All right. So next, what we're going to do, uncross your feet for me. Thank you.
Can I take off the shoes?
Yeah, you can. You can take your shoes and socks off.
Oh, you want me to?
Yes,
My feet are
please.
still. That's on my feet. That's your call.
All right.
Kick them somewhere. There you go.
All right. All right. So next, can you clench your teeth together for me? All right. So I'm just feeling her. And this is part of the trigeminal, the cranial nerve number 5. So I'm just feeling the muscles and the masseter. And I can feel her masseter muscles moving. So those were really good. See, that was not painful at all.
No, but that.
You think that was painful?
Yes, I don't even want to touch my eyeballs. That's when I graduate.
Do what?
I graduate in May 2025.
Oh. That's when you graduate?
High school, not
Okay. All right. So, during the conversation, I'm just looking at Madison's overall facial features. And what I'm looking for is I'm assessing cranial nerve number 7. And so I'm looking to make sure her face is symmetrical, her lips aren't drooping, or her eyes are not drooping, or anything like that. So apparently I've kind of freaked her out by doing that. So can you raise both your eyebrows for me?
Yeah.
Okay. And close your eyelids for me. Okay.
Do you want me to still my eyebrows?
No, that's fine. You can put them down. So that was symmetrical. All right, frown for me. Okay.
I can't do that.
All right, so she frowned and she smiled for me. So can you puff out your cheeks? There you go. There you go.
I forgot how to do it.
All right, close both eyes for me. I'm going to try to open your eyes. Okay. I'm not going to hurt you. Close both eyes.
That's my eye.
I'm not going to touch them. All right. Okay. So what I'm assessing for is making sure she has strength. Madison's a little wiggly.
I don't want to touch your eyeballs.
I wasn't going to touch your eyebrows. I was just going to kind of do what you did. I wasn't going to open it and just see if you could keep them shut.
I can keep them shut.
Like that. Okay.
I can do it.
So, yes. Now, one of the other things of the facial cranial nerve is you want to assess for taste. So what I would do was I could put something sweet and something bitter on the anterior part of her tongue. And I would do that at different times. But she did not really want to do that. So that's why I'm verbalizing that is one thing I can do. So the next thing I can do is I'm going to assess the acoustic cranial nerve, which is cranial nerve number 8. Madison, can you please stand here for me?
Sure.
All right. All right. So, what I'm going to have you do is I'm going to have you take your finger and close off this eardrum, okay? And I'm going to stand a couple of feet behind you, and I'm going to whisper a couple of words, or a couple of things, and I want you to repeat those to me. Take one step up. Maybe one more. There you go. Okay?
You counted.
Can you tell me what I said?
8, 40 something, and 30 something.
All right. Can you, if I say it again, you're going to have to repeat it back. Can you remember?
Maybe.
Okay. All right.
You said red, green tree.
Yes. Okay.
Right.
Yep. All right, now close this one and undo this one. Okay.
Pizza, boys, and fajita.
Oh, she's got boys on her mind. Yes,
That's what you said.
That's what I said. All right, you can sit back down.
I got no boys on my mind.
She says she doesn't have boys on her mind. All right, so the next thing I want to do is I want to do the Weber test. So what I'm going to do is assess if she can hear the sound in both of her ears. So Madison, I'm going to hit this and I'm going to put it on your forehead right here, okay? And tell me if you can hear that in both of your ears, okay? I said forehead, but I meant
I was about to correct you.
Yeah.
I cannot hear that.
You cannot?
No. That bad?
Whoops, that was a little hard.
I can hear that.
You can?
Mm-hmm.
Both ears?
Yeah, probably because you couldn't reach through my thick hair.
Yeah, that did help me parting it there a little. Okay. One more time?
Mm-hmm. I can hear that.
Okay. Yeah, I think the first time I didn't part her hair very good. And then I whacked it too hard. All right. So now I'm going to do the Rhine test. And that is just to make sure about her ears also. All right. I'm going to place this behind your ear. Let me know if you can hear it. And let me know when you cannot.
I can hear it.
You
I can hear it.
You hear it now.
Mm-hmm. I hear it now.
Okay. So that was normal. Let me know if you can, when you cannot hear it no more.
I can feel it, but I can't hear it.
Can you still hear that?
Mm-hmm. I can't hear it no more.
Okay. So that was normal for her. And so next, what we're going to do is we assess the, I apologize, I have inside dogs and I have shut the door, but they may come knock at the door. All right. So one of the things, the next is I'm assessing the cranial nerve number 9 and which is the glossopharyngeal nerve or cranial nerve, and cranial nerve number 10, which is the vagus nerve. So I'll assess those together because if they have problems, the nerves overlap in the back of in the pharynx, so you would find problems there. So one of the things I'm going to do is I would listen to her as she speaks. I'm going to listen for if she has a nasally voice, if her voice sounds nasally, or if she has a problem with hoarseness in her voice. And also another thing is I want to look or assess and see if she has any difficulty swallowing. So, Madison, do you have difficulty swallowing?
Not right now.
No. Do you ever have difficulty swallowing your food? I don't mean like when your throat's sore. I just mean like it's difficult for you to swallow your food.
I eat too fast.
Oh, if she eats too fast. Yeah. All right.
Like in the morning.
So what I'm going to do is I'm going to have you say ah, and I'm looking to see her pharynx move and her soft palate move, and also if her uvulus midline. And I probably am going to need a little help and using my pen light so I can see back in there.
You're going to stick that in?
I'm not going to stick it in there. I'm going to go ah.
Oh, good.
Okay. And her soft palate rises, and her uvula is midline. Stick your tongue out for me. And her tongue is midline. So, yeah. So, So, me and Madison talked about it ahead of time. I would also, while she's saying I would assess her for gag reflex. She has declined to do that. So, I am not going to be doing that. And I could use like a Q-tip and go to the back and touch it to assess assess for gag reflex. So the next cranial nerve I'll assess is cranial nerve 11, and that is the spinal accessory nerves. So Madison, can you stand? Yeah, can you stand up for me?
You're in my back with that thing, aren't you?
No. So I'm just going to lift her shirt up, and I'm going to look, and I'm wanting to look and see if there's any fasciculations. Sorry, and or if there's any atrophy. So you can see that her back looks good and there's no atrophy. So no problems there. You can go ahead and sit back down. All right. So, and then I have been looking at her, assessing her throughout those now. And so now, Madison, can you raise your shoulders up against me? All right. So that's good. All right. So turn your head against my face. Oh, there you go. All right. So her strength is good. All right. Go ahead. All right. There you go. Good. All right. So actually, cranial nerve number 10 is a hypoglossal nerve. And this is where I should ask Madison to open her mouth. And I'm wanting to look and see if there's any tremors and make sure that the tongue is good. Well, your tongue might have. And also make sure there's no muscle twitching. So, there you go. So there's no tremors of her tongue or inside her mouth or anything like that. So, Madison, I'm going to put my finger against your cheek. Touch it. I want you to take your tongue and touch it and push my fingers away. All right. I'm not very strong. All right. There you go. So that was good. That was normal. So that was it for the cranial nerves. So now we're going to go on to the cerebellar function and proprioception. And Madison, what I want you to do is take your hand, and turn it over rapidly. It's going to be kind of like patty cakes. Yes. I know. We're trying to see back. Rapidly. What trying to do? Put it on your hand. Put it on your legs. Oh, my legs. Oh, too much. Right. See if I have Parkinson's or not. Well, make sure you have good movement. Okay, that's good. All right, so next I want you to do is stand up for me. Walk in one more. No, well, I want you to tap your heel to the floor. Because I can do that. You can see her tapping her heel to the floor rapidly. I can do that. I did jazz. I can do that. So she's doing a really good job doing that. Mm-hmm. Can I sit down? Yep. I don't have Parkinson's. No, you do not. Oh, I forgot. While you're standing up, Madison. All right. Okay. Stand there with your hands at the side and close your eyes. Stand there. Okay, so she's doing really good with her balance and standing there. All right, Madison. No. One more. Did you have your eyes closed while you were standing there? Okay. Close your eyes again for me. Stand up straight. All right. Put your arms out with palms up. Right up? Yep. And I'm sorry. I will put this back up for you. Arms out, palms up. Straight up. Straight out. All right. Don't let me push your arms down. I'm not very good though. Okay. And don't let me push you. All right. Good job. That was not a good job. That was really good. Do what? At least I don't have parking. Oh, one more thing I did forget to have you do. Can you walk? Like walk for me. Make sure I'm not sure. Walk back there? Yes. I'm going to have you walk back there. Just walk in a straight line. Yes, walk in a straight line. And walk back. Yes, ma'am. I will. Don't we sit back down? Yes, ma'am. Please do. I apologize for the phone ringing. I did forget to unplug that. All right. So now I want to assess your sense of touch. Okay? Touch. Yes.
You want to touch stuff now?
I'm going to touch you.
Again.
Yes, again. All right. So, I'm going to take different objects and touch you in different places. Let me know when you feel it, okay? And where you feel it. So I need to know where it is and if it's soft.
You have to close your eyes.
Yeah, you'll close your eyes. So if it's dull, soft, or pokey, sharp. Okay? Yeah. All right. So keep your eyes closed for me. Don't open them. Okay?
You can put it right there.
What was it?
Soft.
Soft? Okay.
Right here.
Mm-hmm.
Soft.
Okay.
Right here. It was hard. I mean, that thing, sharp.
Sharp? Okay.
Sharp. Sharp. I mean, soft. Right?
And when was it?
I think it was soft. Right here, the Q-tip.
Mm-hmm.
Sharp. I mean, no, the Q-tip.
Dull?
Yeah.
Okay.
Soft. Soft.
Mm-hmm.
Dull. Dull.
All right, so which ones have I done?
How can I remember all that?
You did the Q-tip.
Yeah.
Okay. Go ahead. Close your eyes.
The sharp one.
Mm-hmm.
Sharp.
Okay.
Open my eyes.
Nope. I got to do your legs and your chest. Sorry, I'm not going to take that off. I'm not going to take it off. I'm just going to pull it down.
Right here. And it was soft.
Okay.
Is that your finger? The Q-tip? Dull.
Don't look.
Sharp.
She's a wiggly patient.
That's a gag part.
A gag part.
Mm-hmm.
Oh, it gags?
Yes.
I didn't know it gags.
Reflex, whatever thing.
I'm going to pause for 1 minute, and I'm simply going to pause for just there's some visitors just come in. I apologize about that. That was my parents coming in. All right, close your eyes so we can finish.
Right. It was soft.
Okay.
Soft. Right here. Right, got the sharp object.
Okay.
The sharp object.
Mm-hmm.
The Q-tip. The dull one. The dull.
Okay.
The dull one. The dull one. The dull one. No, the soft one. The soft one. The sharp one. The dull one. The sharp one.
Mm-hmm.
The soft one. The sharp one. That tickles.
Tickles?
The dull one. Okay. The sharp one. The soft one. The dull one. The sharp one.
Yeah. Alright.
Can I open my eyes now?
You can open your eyes. You did a very good job. And thank you so very much. Alright, so, no, we still have a little bit more to go. I really appreciate you doing this.
Yes, I got stuff out.
Yes, she did get stuff out of it. Did bribe her. So that's all 100% true. 100% true. Alright, so next I'm going to test your response to vibration, okay? So I want you to know, let me know if you feel something or if you don't feel vibration, okay? So close your eyes. Yeah, you gotta close your eyes, and I'm gonna use your fingers first.
Yes, I feel that.
You do?
I don't feel that one.
Okay.
I don't feel that. Well, I can feel it on me, but I don't feel the vibration.
You don't feel vibration, okay. Yeah, that's what I'm wanting to know.
I can feel that. I feel that. I thought you were talking about the vibration. I can feel it, but there's no vibrations.
Now you can feel it.
I can feel that.
What do you feel?
Like it feels like ringing in my ears.
Is it vibrating?
Yeah.
Oh, okay.
Like ringing in my ears.
Okay. So you feel the vibration.
Yeah,
okay.
I just forgot the word.
Okay.
I can feel it.
Vibration or no vibration?
Vibration. I didn't feel vibration anymore. It went away.
Okay, so there's no vibration.
It was for like a split second. I don't feel any vibrations on that.
I think I had muted it with my hand. Alright. So, did you feel any vibrations with this? You did?
Is it still on me?
It's still on you, but did you feel it vibrating? Did you feel it vibrating before?
But it went away. Like it stopped. It ran out.
Do you feel it now vibrating? Okay. As you can see, there was a couple of times she said she felt the vibrations that there should not have been a vibration, as you can see. All right, so now I'm going to do your feet, okay?
I'm not good at this thing.
But it's okay. You just reporting what you said, and I just had to address it, okay? You're just reporting what you feel. Alright, so now I'm going to do your feet, okay? And I want you to do the same thing. Let me know if you feel vibrations or if you do not, okay? Alright.
I have to close my eyes.
Yep, you have to close your eyes. You can feel that one?
Yes. My feet are very aggy. I can feel that.
So when you say you can feel that,
the vibration.
You feel the vibration.
Do you want me to say if I can just feel it or with the vibration?
Yes. Okay. That's what I'm needing to know is if you feel vibrations.
I can't feel any vibrations. I feel vibrations then. Just a little bit though. Not a lot. I don't feel it anymore. I can feel vibrations then. No vibrations. Okay. No vibrations. Making my feet tired. I can feel vibrations.
Alright, so she can feel the vibrations. I think maybe what I did earlier was I wasn't getting them stopped so much. Alright, so I'm going to do something now, Madison, called a 2-point it's discrimination, and I want you to tell me when you can no longer tell that there's 2 points to this, okay?
Like point, like like cutting me.
No, it's not gonna touch you. Like, let me borrow your arm. Like, you can feel the 2 sides now, right? The 2 ends. Can you feel the 2 ends? You can feel the 2 ends. So what I'm going to do is put them closer and closer and closer and closer together. So I want you to tell me when you can no longer tell that there's 2 ends.
Oh, okay.
Okay?
But close my eyes.
Yes, ma'am. I need you to close your eyes. Okay. How many points?
2. 2. 2. 2. 2. 1.
Okay.
Right?
And that was pretty much touching each other, the points were.
There was 2?
Yeah, but they were touching each other. They were very close together. Yeah. No, it's not a game. You were good. You did just fine. Close your eyes.
2. 2. They're not close together.
Mm-hmm.
They're still like that.
Yeah, they're really close together. Okay. So, next, I'm going to have you see if you can, there's a couple things I'm going to have you see if you can tell what they are. And I didn't have them out so that you wouldn't know what they were ahead of time. Alright, so go ahead.
Like a hand in the box thing?
It's kind of like a hand in the box thing. But there's no box.
And my eyes are closed.
And her eyes are closed. So, tell me, close your eyes, hold the thing out. What is this? With one hand.
A nickel?
It's a coin, yes.
What is a nickel?
It's okay, as long as you can tell it's a coin.
Oh, no, that's a bit.
Mm.
But they're the same size as that.
Okay.
A nail? Is that what it is? One of those things that you push into the ground like a drill thing. Am I right? Like a nail?
What's the other name for it?
I don't know the other name for it.
So what do you have to put it in?
A drill?
A drill. Is that maybe a screw?
Oh yeah, screw.
Okay. I think Madison recognized what it was.
Yeah, I knew what it was.
But she forgot the name of it. Alright. So, close your eyes.
You're not done.
Nope. Close your eyes. Other hand.
It's a pen.
Okay, so she recognized that was a pen.
Alright. Another one?
Yep.
This is a Q-tip.
That is a Q-tip.
That's not very hard. Give me a hard.
Give you a hard one? Oh. Well, so she's asking me to challenge her and give her a hard one. Let's see what I can find to challenge her. I don't know what I can find to challenge her.
Is this like a bandage thing or like tape?
So that one actually was too big for it, but for the assessment. But yes. All right. Now close your eyes and let me borrow your hand. And I'm going to write some letters, and I want you to tell me what they are. Or it'll either be letters or numbers. Okay.
That 8?
Yep, it was the letter 8. Number, I'm sorry.
An A?
Yes.
Oh, uppercase.
Yes, it was an uppercase A. Okay. Let me have the other hand.
What's that?
I think I confused her because I stood the wrong way. So that was a learning lesson to me.
A 2? Oh, you didn't like a that. It's 7.
It was a 7.
Sorry, you write your 7s. I write my 7s like that. I put a letter with a line through it.
I think part of this comes like from the age differential, how we learned how to write our letters.
Oh, I got that from my 3rd grade teacher. I liked how she drew the 7 steps. I just can't not that was my thing.
Okay. So next, I want you to tell me what it is.
A 3? Or a B?
Yes, it was a B. Yeah, it was a B. All right. So keep your eyes closed for me.
Gonna do it to my leg now?
Do what?
Is there was you gonna do it to my leg?
I'm going to touch you, and I want you to tell me where it is that I'm touching you, okay? All right.
Let's make it PG.
Do what?
So let's make it PG.
Make it peachy?
PG.
Oh yeah, it's going to be PG. Definitely PG.
That's a joke.
Okay, definitely PG. All right. So, I want you to tell me. I'll touch you where it's at.
Right.
What was it, soft or hard or
It
dull?
was soft. That just caught me off guard.
Caught you off guard. Okay.
Was that with your finger? With your nail?
Was it sharp, dull, or
It was
soft?
like kind of sharp. Was it with your nail?
I just need to know if it's sharp or dull.
Sharp.
Okay.
Right. It was like that.
And
So
it was
right here, and it was dull. Sharp. Sharp.
Okay.
Sharp. I mean soft.
Okay.
Sharp.
Okay.
Soft. Dull.
Okay. All right. So now, Madison, I'm going to let you see up, up, up. In a minute, I'm going to have you tell me if your finger, and this is down, down,
With my eyes
down.
closed.
Yep. And I want you to tell me what it is I'm moving and if it's up or if it's down.
Like which finger it is?
Mm-hmm.
Let's see about that. It's my thumb.
Well, I'm just letting you feel it now, okay? Oh. All right.
My toes don't really move.
So this is up.
Yes.
And down. Okay. Up.
See, I'm moving that moves.
And down. Okay. All right. So I'm just going to bend that way. You can't hear me getting up or down to do it. Okay?
Okay.
So put your fingers here for me. That way.
Don't catch me by surprise. I would kick you on accident.
Oh, please don't kick me. All right. So I want you to tell me here in just a minute if it's down or up.
Let me blink my eyes.
Okay. If it's down or up and what it is. Okay.
It's my thumb. You're doing the up. Okay. That's my big toe. You're doing down.
Which big toe?
This one.
Okay.
Left. Right. That's my other right big toe. You're going down.
Okay.
I'm sorry. That's my thumb again. You're going up.
Which thumb is it?
This one.
Okay.
The same one you're going down.
Downtown. Okay.
Oh, that's the same big toe we were doing. And
what side is it?
This one. I can't tell. That's this one, and you're going up.
Okay.
You're going up.
Okay. And what is it?
This one.
Okay. All right. So thank you very much for that. All right. So now I want to test your reflexes, okay? Well, I hope you're not telling a story.
I tested it earlier and it wasn't doing it.
What wasn't?
My leg wasn't going up.
Oh.
Are you kidding my leg?
See, I'm gonna hurt
you. We'll see about that.
You think so? Okay. All right. Just relax. Just relax. So I'm going to strike the muscle just above the elbow, and what I'm assessing is like for her triceps reflex. So what I'm assessing is that, and so she needs to have her arm slightly flexed. All right, and now I'm going to assess her biceps reflex. Relax. And
I felt it.
A slight jerk. Can you take your bracelets off for me?
Sorry. I'm taking this off now. This is a first.
Alright, so now I'm going to assess her brachioradialis reflex, and her hand is going to be where the thumb is slightly up and just above the wrist. And I'm looking to see if there's movement, and there was. Alright, and again for the triceps. How's the other side move?
I don't know. I'm telling you what, I don't have any reflex.
There was some movement. Alright.
That was barely. This one that I moved.
Okay. And there's reflex. Maybe some of it's a little exaggerated. I
don't know.
It's a little sharp object, isn't it? Alright. So, since you watch Esmar, what's the next thing I'm going to do? Check.
You checked all of them.
Well, I got to check your patella.
I was going to say you weren't going to do that, Steven.
I got to do it.
I hate it.
Okay.
It hurts.
Alright. Just relax your leg. Oh, see, that was good. Yes, you can put your bracelets back on. Alright, so now I need to check your Achilles reflex.
Oh, my foot.
Yeah. And I could feel a reflex. Alright. So that's good. Alright. Can you lay down for me?
Yeah.
Oh, scoot over this way for me.
I'm flashing everybody.
Alright, here, let me flip it. Scoot that some. Alright. So what I'm going to do what?
I said, no one can see my feet.
I cross your legs for me. Okay. So what I'm going to do now is I'm assessing her abdominal reflexes. So she's going to put her arms beside her. It was her beside. I'm not going to make you naked. That's
tickles. It touch me there.
All right, just 4 times.
I'm gonna.
4 times. 4 times. Okay. Madison. 4 times. Put your hands down.
It's gonna tickle.
It may tickle, but it won't tickle long. Okay. Let me try it. So what I do is I start in the upper quadrant for the upper, and I come down. So you can see her reflexes. And then for the lower quadrant, you start below and come up. Apparently there is some reflex. Okay. Alright. Sit down. Lay down. Alright. Now I'm going to see if you have reflexes on the bottom of your feet. Plantar reflexes.
That is much.
Do you think you're going to have plantar reflexes?
Mm-hmm.
Okay. And do your legs. So you can see her feet.
Mm-hmm. I think so. I think it's my feet. People have foot fetishes, you know.
Oh.
Mm-hmm.
She's full of information. I'm sorry about everything that's on Google or anything like that. Foot fetishes. I'm sorry. All right. So.
It's a true thing.
True thing. All right. So now we're going to test your plantar reflex. Okay. So I'm just going to stroke this along the side of your heel, your foot.
Is that?
All right. So you can see that she has some reflexes with that. Nope, not yet. Now we have to test your ankle for ankylosing.
Ankles.
Yeah.
People have ankle fetishes too.
Do what?
People have ankle fetishes too.
People do?
Leg fetishes.
Oh. Okay. All right. So I'm going to support her leg just below the knee. And then I'm going to relax. Dorsiflex the foot and plantar flex.
Okay.
Dorsiflex. Plantar flex.
I think it doesn't.
And do that for the ankle cross.
I think it can do that.
You think so? Okay.
I know so.
Alright. Dorsiflex. Just relax.
I'm trying. I think you're popping.
Popping your ankle.
Yes, I don't like things popping.
And you can see it kind of stayed dorsiflex. There you go. And that is the end of my assessment. And I appreciate you guys taking the time to watch it. And thank you so much.